quick and rapid and non-invasive.
Have a kind of non-invasive way.
January 27, 2020, the first COVID-19 case found in Canada. PCR tests became the new norm as people rushed to see if they were infected. Fast forward, and researchers have found new ways that are potentially safer, faster, and non-invasive. Some including apps and dogs.
Every dog can sniff, but not every dog can work. Only a very small percentage of dogs are actually suited to be working detection dogs.
Zerberg's team wanted to see if they could train dogs to detect COVID. Meet Micro, Yoki, and Finn. These dogs are presented with samples of COVID-19 through saliva, breath, and sweat, prepared in a way that removes the risk of transmission.
The dog's scent computer in their brain is so different than anything that we can understand and haven't even been able to replicate. Guessing that the dogs are able to pick up on the metabolic changes that the virus causes within our body, and that those changes are really specific scent picture.
The pups were found to identify it almost 100% of the time. Teresa says using dogs is beneficial as they are quick, non-invasive, and transportable. Unlike a PCR test where you have to send the collection back to a lab, these furry friends can be transported anywhere and sniff you on the spot. Back in Calgary, a team of researchers are designing an app to detect COVID-19 in a different way by coughing into your cell phone.
And eventually we figure out that there is some common pattern between the positive and negative people. So we move to the next phase by building a sort of artificial intelligence back end so we can automatically classify positive and negative people and give some suggestion to people who are using this app to see a physician or to continue testing.
The team has completed their first experiment, and now
Second experiment is a kind of clinical experiment. We need to take it to the patients through some hospitals and ask them to use it somehow in a controlled environment and see that whether what we have collected or we have trained matches the reality.
Dr. Farr adds, if this is successful, they will work to deliver it to the public. And they want to assure future users that they designed the app to only keep your cough and no other personal information. In Calgary, Christy Kilburn, City News.